So module 7 and week 7 in the mentorship is all about lower limb return to play. So this is like the key thing now. Your patient's out of pain, but how are we actually going to get him back on the pitch or get him back to real life, making sure the pain doesn't come back again? And I think this is where a lot of therapists go wrong. I think a lot of people jump from being pain-free to getting back and let's try a run this week and see how it goes. These progressions in this kind of module is how we can bulletproof our system to make sure, or give us the best possible chance that we can discharge that patient confident to know the pain's not going to come back. Now, in terms of what progression specifically we're going to use, this comes back to module 1. So we need to be really clear on the end goal. So depending on what the end goal is, that's how I'm going to build my progression. So my end goal obviously is going to be very, very different for somebody that wants to get back running. So let's say we've got somebody with knee pain, and I've got one person with knee pain wants to get back being able to run a marathon in 3 hours, and I've got another person with knee pain that wants to be able to go for a walk in the dales and lift the grandkids pain-free. So the progressions that they need to go through are going to be very different. Does that make sense? Now, they're going to be similar, but obviously I'm going to have to take the person that does a 3-hour marathon is going to have to do a lot more hopping for me, a lot more impact-based stuff, and a lot more volume stuff. Whereas the person who just wants to be able to walk pain-free and lift their grandkids, I might just be happy with lunging for them. Does that make sense? So it just depends on where you want to get them towards. And that's why going back to module 1, the end goal is so important. But coming back to module 7, so the journey up to this point, so for module 2, the lower limb, we've looked at the assessment and treatment for lower limbs, and this is pretty much our sessions 1 to 3. So by the time we're getting to these progressions, we should be pretty much pain-free. We've restored full passive and active range of motion, and we've got good intent in all directions on the bed. And we've taken them up to the position where they can co-contract well, they can work well isometrically. Now we want to gradually change the variables of load and change the variables of speed to make sure they're going to be able to handle real life. How far we take them, again, just depends on where they want to get towards. Okay, so let's take an MCL injury for an example, okay? And let's just take the first progression of a lunge. So obviously we can lunge and step forwards, and there's 2 things we can do. Just do a normal lunge for me, Sarah, first. Good, and that's what most patients will do when you ask them to lunge. And that's fine if we want to work a lot of eccentric quads. So if we're building quad strength in the gym or whatever, that's absolutely fine. If I want to get back walking though, that lunge is not going to have a great carryover for me in terms of being able to walk in the dales or walk wherever. So what we really want is an elastic lunge, and I want to see a co-contraction at the knee. So what I really want to see with my patients when I'm taking them up to a lunge, first of all, is that they can step and stop. And it's a small step, just as if they're walking. It's not a lunge, they're not losing any height. All the momentum is going forwards. Just do a couple of those there. So small step, just letting your chest bone come over your midfoot. That's it, nice, good. Still bend your knee. That's it, nice, good. And it's a completely different movement. And if you do it yourself, it's actually quite challenging. If you take a small step and let your weight come forward, it's actually quite hard to decel and slow yourself down. Now, if we've done a good job on the module 2 stuff, we should fly through this. So when they get to this stage, we've already given them a good awareness of the midfoot. We've already built them up to this progression. So by the time we get here, they should hopefully be solid. But when we try it ourselves without going through those progressions, it can be quite hard to do. And so our first progression is just getting them comfortable being able to find the midfoot quickly. Now the difference between this and our isometrics or our co-contractions is with our isometrics and our co-contractions, we're getting into those positions, we're getting the midfoot, building tension, but once we've done that, our work's kind of done, and then we're just doing reach, or we're doing a lean forwards, or whatever we want to do to bias certain tissues. The difference now when we get to a lunge is we need to be able to react when the foot hits the floor. So as soon as the foot hits the floor in a split second, ankle, knee and hip need to react really, really quickly. And I need to be able to find the midfoot quickly and co-contract that in my peripheral limbs. So the difference here really between the co-contraction stuff and the lunge is the speed. Now, when the foot hits the floor as well, we have to remember we're going to have those unexpected perturbations. So we're not going to hit the floor the exact same every time. There's going to be unexpected wobbles, and we need to be able to manage that. And that's all going to be on like a preflexive, reflexive level. So just like sport, if I'm going to change direction, or real life, if I'm going around the corner, I need to be able to, I don't have time to think about every single little adjustment I need to make, and that needs to happen preflexively and reflexively. The same with these. That's what we're trying to train with this, is that it's no longer conscious control. So when we're doing all the slow stuff, we've got time to think about it. We can focus consciously on what we're trying to do. When we get to this point, it wants to be more subconscious now, where it's happening automatically. Does that make sense? So our lunge going forwards, if you take a step forward, Sarah, so again, just do a couple more of those to start. The small step, that's it, nice, good. Let your chest bone come forwards over your midfoot, good. Bit softer in the knee. That's better, nice, good. Nice. Good. And we can see what Sarah's trying to do here is lean forwards. So rather than letting her hip come over her foot here and actually anteriorly translated the pelvis, she's trying to get her weight forward by leaning forwards. And that's what you're going to see patients do as well. And we want to kind of train our eye to spot these kind of things. So let's do the same thing again, Sarah, but I want you to let your whole, don't lean forward, stay nice and tall. Just let your whole body weight come forwards over your foot. That's better, nice, good. And see the wobble now when she goes forward. And that's what we're trying to recreate with this lunge, is those little unexpected perturbations. And I like that because that's stress, that's putting our system under stress, and our nervous system is going to learn from that. So what she was doing before was too easy. You know, your brain, you can find that your hamstring gastroc can handle that really well. This is now challenging the nervous system a little bit. So we're challenging the base of support, allowing those reflexive reactions to wake up and work a little bit. Perfect. Nice, good. So let's say Sarah has an MCL injury, okay? So what might our first progression be, Sarah, for you? If we want to add a reach into this to protect the MCL. So we haven't got into lunging yet. I'm a little bit worried that this might flare the MCL up. So what can I do first to give me the best possible chance of doing this safely for an MCL injury? Exactly, yes. So just do a few of those. That's it. Nice, good. And again, we were taking Sarah straight into this without doing the warm-up drills first. So again, it's going to be quite challenging. So again, as we're going this way, we're going to drive more load laterally, because when I step forwards and go this way, I'm going to drive a varus at the knee, or my momentum is going to be going laterally. So that's going to take load away from the medial side, obviously, and the MCL. I'm going to get a lot of, you know, biceps femoris, a lot of VL on the outside as well. If I wanted to stress the MCL, I'm just going to go the opposite way. So again, let's do a few of those. So stepping forwards, reach, good. So now going this way, we're going to get a lot of VMO, we're going to get a lot of medial hamstring, and we're going to put a lot of stress through the MCL. So why this is so important is when we get to sport, for example, is we're obviously going to need to get it. If we've got an MCL injury, rather than avoiding it, what I think a lot of people do is, okay, keep your knee over your second toe with this exercise. We're going to do squats, keeping your knee over your second toe. And that's all well and good, but when someone gets to sport and they need to change direction and turn, they're going to need to be able to tolerate that kind of a force at the knee. So rather than avoiding it, we need graded exposure safely. And we don't want to irritate anybody, but we want to, before I take anyone to any change of direction or decel drill, I want to be able to do this at pace, where I'm putting a lot of momentum through my knee. I'm really reaching. It's a small step, big reach, and they can tolerate that without getting any pain, without getting any flare-ups, with confidence, no apprehension. Then they're ready to progress. And that's when I know someone is ready to progress to the next stage, is they're able to do it fast, at pace, without any flare-ups. So our first progression then, so once we've got our reaches and we've progressed, let's say our MCL injury to the point that they can do this, the next stage now is just starting to gradually increase the speed. So rather than jumping, okay, they're good at that, let's go to the next exercise. Let's stay on this exercise, but let's make it harder. Let's increase the pace a little bit. Maybe even get a medicine ball, a bit of weight, and put a bit more momentum into it. And then let's increase. Now I might go to a leap. I might go to a hop. I might work more frontal plane, so to go more of a frontal plane driver. I might go more transverse plane. So we can play around with the direction of the step, and then we can play around with the speed before progressing to the next stage of graded exposure. Does that kind of make sense?
Yeah, so would you kind of take them to that next level and then realise that maybe it's not enough for them and then regress them, or would you?
Yeah, definitely, yeah. And I suppose every progression is an assessment as well. So you're actually looking here, and an MCL is an obvious one, but when you've got someone with like non-specific knee pain, or, you know, just anterior knee pain, you'll have found some things on the bed. Now, the interesting thing is when you take them to this level, so you might have found something, let's say sagittal plane on the bed, like a posterior knee stability that we don't talk about in module 2. When we get them up to this stage, we might find actually they're really good in the sagittal plane now, probably because we've been building it up on the bed, but actually frontal plane, they're not too good at all. So when we take them up to the next level, like you're saying, we might actually spot actually that's shocking, or they're inefficient there. And then we might need to rethink, go back to the bed, check a few other things, and each level of these progressions is going to be an assessment as well. So yeah, you're right. And then if we take them up to the next level and we start to see flare-ups, or we start to see anything like that, that's when we need to take them back and go from there. What's important to not trip ourselves up is we have some kind of a KPI. So a KPI, a key performance indicator, is going to be something that we can recheck after each progression to make sure that the nervous system isn't laying down any motor adaptations. Does that make sense? So let's take like a pinch in the groin, let's say a hip flexion. If we clear it up on the bed, that's pain-free. Then we take them up to lunging, we check that again, it's pain-free. We take them up to the hopping progressions, and actually that pinch comes back. We're probably pushing them a little bit too far. So then before the pain even comes back for them, we've got our KPI that indicates that, or maybe it might be a toe touch for back pain. We'll take them back, focus on the previous progression for a few days or a week or whatever, depending on what environment you're in, and then we'll progress them again. Okay, so I think that the big things to take away from Module 7, so obviously we've got the step-by-step progressions, which are important, but I think what's more important on a general level is playing around with the variables. So play around with the speed, play around with the directions, so transverse plane, frontal plane, and sagittal plane, and then start to increase the load, then start to increase the volume.
So I've just finished week 7, which was the lower limb return to play. So this is like the first section of the lower limb return to play before it goes on to like outdoor stuff. I've really enjoyed this one, I'm not gonna lie. It's been more my area of interest. It relates more back to what I do with the rugby team as well. So yeah, I've really enjoyed this. So next week is week 8, which is upper limb return to play. I'm quite excited for that as well, because obviously with working with the rugby team as well, you get a lot of upper limb injuries. So if it's anything like what this week was like, yeah, it'll be good.